So we discussed glucometers, and this has been the mainstay of management of diabetes for decades. Recently, and by recent I mean several years now, there have been a fantastic innovation called a continuous glucose monitor, which basically you may have seen ads for, but essentially is a little device, we call that a sensor, that you place over your skin. It has a little catheter, so it's not a needle, but it's just a little catheter, and it measures what is the equivalent of a blood sugar, but it is important to understand it is not exactly a blood sugar. So what these devices are is that they're checking your blood sugar every 1 to 5 minutes, and then they can give you a reading on either a phone or sometimes they come with their own readers, basically in real time and continuously. So it avoids finger poking. Whenever you want to check your blood sugar, you can simply just look at the number on a screen and then decide what you need to do as far as management is concerned. So they are absolutely fantastic tools. They are shown to reduce some of the burden of care that comes with management of diabetes. It helps to reduce low or hypoglycemic blood sugar events. And I am a huge proponent of them. But like all technology, they can fail. And it's important to know what to do if they fail, and that is to go back to a glucometer. So a couple of things to keep in mind here is that these sensors need to be replaced anywhere from every 10 to 14 days is the FDA indication on them. They are these devices you place over your skin. There are a variety of places, and they're not checking a true blood sugar. Okay, they're checking something called interstitial fluid glucose, which then is sort of calibrated to reflect your blood sugar, and they're FDA approved for insulin therapy and decision making. But there are times if the CGM reading does not feel right to a patient, it's important to check the glucometer, or if the numbers are either too low, typically we say under 80, or too high, typically we say under or over 300 rather, it's important to confirm with the glucometer. There are a variety of brands. The ones that are approved in pediatrics are right here.